Hey, Margie here. Are you ready to learn the needle movers when it comes to lifestyle modifications and bone health? Well, if so, you are in the right place because we're going to delve into this topic today with our very special guest, Dr. Melissa Mondala. And Dr. Melissa is a triple specialist of family medicine, lifestyle medicine, integrative psychology, and double boarded in family medicine and lifestyle medicine. She is one of the first nationally recognized lifestyle medicine intensivists and serves as core faculty at Loma University Preventive Lifestyle Medicine Department, which is one of the blue zones for longevity. She prioritizes lifestyle modifications to optimize health, brings evidence based methods to combat chronic disease, and uplifts potential barriers through self empowerment and self compassion. And she works with a lot of people with osteoporosis and osteopenia. And today she's going to share her favorite tool and best ways to really incorporate lifestyle medicine into your life. And I've already learned things that I'm going to put right away into mine. So stay tuned for this very informative interview. Welcome, Dr. Melissa. So happy to have you here on the podcast.
Hi, Margie. It's God, such an honor to be here. Thank you for your time. And I love being here for your community because this is such a under-recognized need and you've just filled the gap. And I appreciate your time and attention to this.
Oh, well, thanks so much. Well, I love all the pieces that you bring together. It's just so wonderful, all the different, really the different certifications and the different, what you've studied and the different pieces of the puzzle. It's just, I think, so helpful. And I'm just really happy that we're going to share this with everyone. So I think what I'd like to start, it would be really interesting to know why you went in so many different directions, a little background about why how all these pieces fit together and why you went on, not just did one, why you did more studying and why have gotten into different areas of medicine and sort of bring those all together in your practice.
Sure. Thank you for asking. Yes, I'm Dr. Melissa Mandala, and my original background, was actually psychology. Really love studying human behavior. That's what I studied in college for a long while. Did research in the doctor-patient relationship. I studied humor in the doctor-patient relationship, how to humanize the experience, how to minimize barriers. But the more I studied about human behavior, I knew that I wanted to know more and more, not only why people behaved the way they did, but what were the factors that contributed to their stress, their depression, their mood, and even more beyond their health. So I went into medicine looking for answers. Really, I came from a family full of um, people who died at a young age in their 50s. My grandfather, he had type 2 diabetes, ended up having gangrene, amputated leg, and then went into a diabetic coma. So we lost him at a very young age. And then my father had psoriasis, and autoimmune disease was very under recognized, underdiagnosed, and during that time there's not many medications, and still there's not, and lifestyle was definitely I would say ignored. So I went into family medicine eventually because I wanted to see all ages. To me, it was important to get the full scope, to see from beginning into end what was the human experience like. Why do we need to look at these milestones so we can get to root causes? But I didn't find the answers. It was really a revolving door. The medications were the only answer, quote unquote. And I also became sicker. I was someone who had GERD, IBS, and horrible acne at that time. And usually it's treated either by antibiotics or very limited options. And I knew that that was not the way I wanted to spend the rest of my life. So I look into lifestyle factors such as nutrition, exercise, sleep, stress management, and all these things became more of the solution. And that was the hope where I saw that there was reversal of disease, not only with myself, but with my patients, getting off medications very safely and methodically and getting their life back with all those without the side effects of medication. And so that's why I first went into lifestyle medicine. And then I pursued more of primary care and integrative psychiatry because I also knew that no matter how you tell people to eat, exercise, sleep more, if they're depressed and anxious and overwhelmed, they're really just gonna give up. They're in a place where their body feels, they call it lead, like heavy as a lead. They don't want to get out of bed. They're anxious all the time. They're having panic attacks, and it's hard to even prepare a healthy meal. It's hard to even make a decision when to wake up, or small things like, for example, they're having stress overload and they don't know how to actually process what's happening around them. So they're in fight or flight mode all the time. And so my end goal was to really figure out what is this pandemic out there. There's such a huge pandemic of mental health, and finally, during COVID, it just became recognized. Just like suicides were just happening right and left all around us, not just in our public, but even in health professional settings. And so we know that mental health is the core to even with bone loss, right? Sometimes we can recommend all these lifestyle factors, but if we're still in fear mode or we're still unable to make daily decisions or habits, it's going to be really hard. So I wanted to address the elephant in the room, which is really mental health. And that's why I went through all these certifications. I love integrative medicine too. So have that fellowship in process to really get the best of all the worlds, if it's herbs, mind, body medicine, and even things like vagus nerve.
I love this because that's what it takes, and that's what I see, and truly a lot of people I see are, they wanna know the absolute best food, and they wanna know the absolute best exercises, but they are so stressed out, and their lifestyle is so full of worry and fear, and it's so hard for them to realize, like, that's a huge piece of it. We can't just throw that out the window. That has to be, and it's incorporated in everything I do, but I love that as a physician, you take that piece and you're even taking it to the next level. So I just, I really love the combination of things that you do and the importance you place on the mental health side because we can't ignore it and it makes a big difference. So what I think what would be so great because you bring so much to the table is maybe sharing what you see has moved the needle. And, with people with bone health, so if someone comes in, they find out they have osteoporosis, so I'm not sure what you want to start with first, but maybe start with how you approach it. And because, I know you do a lot with food and mindset. So maybe just take us through what areas you have seen that you've had the most success and give us tips that people listening, oh yeah, that may be something they can add into their life as well.
Yes, definitely. I think that's always a great question. I have a current patient right now, and she is, already pretty active. She's already eating already healthy foods, and she was a former chaplain working in the prison. Right? She actually was a very busy lifestyle, trying to see if she can work part time, and but also felt focus on her health. And I really think the moment she started to prioritize her health as number one, because she was such a big caregiver. Imagine all her life working in the prison, night and day, going after hours, working two jobs. And a lot of us women, we're just working so hard for each other, our lifetime. We work in at home, we work in the workplace, or just in our community, and we often feel like doing is what actually pushes us forward. And yes, that's one part of it, but it also means rest. And I just want to emphasize that so much because we are a society who is on the go, and we think we have to jump through big hurdles to make a change. But really, the number one thing I recommend is rest. With her blood pressure was up the roof, going to 160 and 180, in addition to her osteoporosis and bone loss. And she was doing her best, exercising, going to chiropractic, going to PT, doing all the quote unquote right things. But what was hard for her was being able to sit still. And she was someone who watched a lot of meditation videos already. She was someone who went to retreats, but the one mindset that she had to get into was just being able to not catastrophize. And sometimes we go into one thing and we feel like we don't do it perfect or right. And then our mind spirals and we start to ruminate and we actually have self-blame and guilt. And then we try to overcorrect and we don't know what to do. And then we feel lost and afraid. So when we actually go into rest mode, we actually get the opportunity to activate our vagus nerve. We turn down all the stimulation around us, or at least go into a quieter mode, quiet our thoughts, and activate the vagus nerve. And so, some things I like to teach about the vagus nerve is not only does it connect to your brain behind your ear, and you can stimulate it by humming or singing, but I also love just using manual therapy, meaning using your fingers, which is kind of fun, and going in behind your ear in circular motions and just rubbing around the behind your ear for 10 seconds. And you can do this on the outer ear or the inner lobe, and then also in the ear canal, and just doing that in the moments of panic or distress. And you're building new habits this way. You're rewiring your brain where things before may have panicked you, but really most of the time it's been okay. So each time I taught her, whenever she had this fear, when even if her blood pressure went up a little bit, or if she felt like sure her body was deteriorating, to just remind herself that she's not only alive, but she can activate the vagus nerve at the same time. Most of the time, we go into all or none thinking too. We think we always have to do it this one way. And if we don't do this one way, it's going to lead to catastrophe, or it's not going to be the best. And I think we have to be okay with even just 20% that day of rest. Or if we're at 5% of rest, that's still a win. Most of the time, we kind of get into the self-sabotage mode, and it's so sad. It's not on purpose, right? Because we're trying to do what's best, and that's probably coming from our orthodoxia kind of mindset, where we love health so much, just like me. And then sometimes we just get obsessive over it, where we just think about it all day, but we don't get to enjoy life. We don't have time for pleasure and the dopamine and the norepinephrine response. So I actually had to prescribe her some fun, literally fun in with her community, to start even baking her favorite meals with her grandchildren again. Things that just lowered her cortisol and activated her vagus nerve. And these are literally like joy prescriptions and rest prescriptions that keep it very, very simple so that she can get into the place where because it was affecting her exercise and her therapy. Even though she was going in there 30 minutes a day at the gym, she would just go frantic. So once we really decreased the stress and the sympathetic overdrive, she was able to be present and allow that actual progress to come alive again. So that opened her mind to other things, if it was not just supplements, but also hormone therapy. So I really love the idea of just focusing on one thing at a time because it is something that we can often go on a slippery slope of, oh, I'm just going downhill, but really you don't have to go downhill. You can take it, you can have a nice, even pathway, and it's usually restorative, one step at a time.
Wow, I love that. I teach a happiness program, and to me, the fun and the joy is part of life. And there's even research on people who are happy or have higher bone densities and everything else. But I love what you said for so many reasons. Number one, we don't think about that. You're thinking about your bone loss. What can I do? Let me eat, let me exercise. It's go, go, go. It's not, oh, let me rest, or let me, because the body does need rest, and it needs to rejuvenate, and it needs to do that. And it's just certainly not the first thing. So that's, I think, amazing that, you go see your doctor, and what are they telling you? To rest and have more fun, and to Yes, do all that, but a couple questions. So when something stressful happens, I like that also before you start to freak out, you have something physical to do with this vagus nerve. It doesn't matter what direction. Is it clockwise, counterclockwise? That your does it
Good
matter?
question. Yeah, it doesn't matter what direction, but small movements with your fingers behind your ear, outside of your ear here. It doesn't matter what direction. One thing that can also help is I love recommending just putting an ice pack on your chest when the panic does happen or when you feel like you're having racing thoughts or palpitations, and just having that ice pack on your chest for 5 minutes, 10 minutes, as long as you can tolerate. And it's just enough to quiet your nervous system and feel comfortable because most our body has memory, right? Research after research shows that our cells remember and the trauma remembers stays in our body. So what we want to do is create a safe place for our body, make it comfortable, nourish it, take care of it as if it's a baby. So what during anxiety attacks, our body likes the cold sensation. So that I love recommending that. And of course, having your lavender essential oils or having that around you. You need to find out something you can taste, smell, and hear that's very calming to the nervous system. So I like to activate all the nervous system factors. And then another thing I usually recommend is not only with the vagus nerve, but also getting into a place of rest and digest. So when I say rest and digest, try not to shove food down your mouth and feel like, oh, this is going to help because that just leads to stress eating. But you likely just have decreased appetite, and that's okay. So try to avoid food at that time because you likely were just going to get bloating and loose stools, and that's just going to lead to even things like IBS. So you definitely want to rub your chest and rub your belly at the same time, and usually that is the one where if I start going into this direction and it's almost like a counterclockwise direction, so that can activate the vagus nerve because that's where your second brain is. So you want to make sure you're rubbing that area very gently, and then another thing
That
I
be
like,
right before you eat then? So
yeah,
before
right before you eat,
just
right.
just to rub with both hands,
Rotate your okay,
not just one body.
movement on your chest and then also your stomach. So that can help you digest easier, especially when you're maybe trying food that you eliminated for the first time, or you're just kind of maybe you're eating at a restaurant and you're like, oh no, I don't know what's in this food, and I may not have control over it, but I'm still gonna eat it because I did the best I can to modify the food that I'm getting, but I'm gonna be happy and thankful. So just rubbing your belly, rubbing your chest. And then I do like emotional freedom techniques and through tapping. And that's another exercise I like to recommend where you can tap the chest, tap the belly, the head. And this helps process things from your right side to your left side of your brain. And then this also brings the conscious, unconscious to the conscious and then releases it out. So I love kind of getting into the unconscious that happens when we're trying to digest or when we're trying to go out through our day and rebuild our life. Because often we have all this 95% of our, they say 70, even 95% of our processing is unconscious. And if we don't get that out of our system, or not just journal, but just have a physical somatic experience with our body, we often get that trapped and it builds up more stress and anxiety.
Wow, it's so interesting because there are a lot of people who I see, and they've been to psychiatrists, and they've been doing so much talk therapy and this and that, but it really hasn't changed anything. But when they've done the somatic work, that's when really miracles happen, where they put it into their body and they do, some of the processes that you're doing. I think that's fabulous. When people are doing this, what should they be saying? Okay, so now we're going to start. Is there something they should be saying to themselves while they're doing this? Like, do you have anything that helps
Yes.
them, here they're freaked out. All right, I should rest. I shouldn't just shove my food in because we know we're not going to digest it. We're not going to absorb our nutrients, and it's going to be it's not going to be productive. So, all right, I'm going to do what Dr. Melissa
Yes.
But is there something they can say to themselves too?
Yes, of course. While they're rubbing their chest or tapping, I always like to personalize it because, sometimes people have heard the words "you're okay" from a family member or friend, and it can be very triggering. So I don't want to just say, that's the word to use. You want to use a phrase that is safe. For example, it can be very neutral. For example, I'm okay, or I'm safe. This is going to pass. This is only temporary. This is my body is just processing, and I will go on to the other side. So I really like to make it short, simple, and sweet, and non-triggering, and really just saying thank you, body, for being here with me. Thank you for being alive and present. And despite what I'm feeling, it doesn't isn't always true. And isn't always accurate. So I'm going to show my body what it's capable of healing. So all these things are just a beautiful way to open up the mind and the heart, with the chakras, but also the energies that move. And the nervous system will regulate. And that's the power of doing this regularly. And I say do this daily if you're in a sense of panic and you feel like the sweaty hands. You want to be able to know that it's okay, even if with every meal, and eat as slow as possible, as you probably all know.
Hey, Margie here. I just want to let you know that you can find my favorite items that make great gifts as well as being good for your own health on my website at margiebissinger.com. Just go to the top and hit the Margie's Favorites tab. And there you'll see the essential oils that I love for $15. That includes shipping. You'll see blue blocking glasses. I wear these every day if I'm watching television or on any of my devices after 8 o'clock at night. This significantly helps my sleep, and there are so many more items. So make sure to check out these products that I personally use and love. So let's go back to the show. What have you seen? What I really taking in here is that, I asked you like, what do you see that moves the needle? And this is the first thing that you said. So you must see in your practice that this really makes a big difference.
Right, it's huge. Yes, I can test for everything from that, thyroid imbalance, parathyroid imbalance, and of course, I check for even estrogen deficiency, autoimmune disease, and their lifestyle. But really, after going through all the comprehensive tests and seeing, we're the fifth and 10th medical doctor, we want to make sure that we are going into the real core of the issue. And usually, the core of the issue is just that fear, that mental state. And sometimes they're lacking even their purpose in life. They feel less motivated. They feel discouraged. They maybe not in a place where they found their secret sauce for their own life. They're feeling lost and afraid. I have a lot of geriatric patients who just feel what's the point of living? Why should I even take care of my health? These are real honest questions that we just got to pull out of the closet. And I have my patients telling me this, and it's really important because um, there are patients, and with uncontrolled depression and uncontrolled anxiety, there's a normal sense of not wanting to be alive. And I just want to recognize that those ideations, those thoughts are actually part of depression, anxiety. I know most of the time people don't feel like they're going to have a plan, and they're not going to, they don't feel like they don't have to call the suicide hotline, but those are fleeting thoughts because they feel like they a sense of feeling overwhelmed, but also a feeling of giving up. So it's important to recognize those thoughts and know, well, you know what? Why am I having those thoughts? It may be I need to not only ask for help, but why, and how often, and is it because I'm depressed and anxious, or is there trauma there? So, and that's why I really dive into suicide prevention a lot because we want to make sure not only we have protective mechanisms for lifestyle, but protective mechanisms around someone's own life. And that's really getting social, finding a trusted friend, getting social connection. They say that's even more important than smoking, drinking, nutrition. It's up to 95% more effective. It's just having a buddy, just like you are, Margie. You're someone that they can just listen to and trust and even confide in. And that's all they really need, is having that sense of companionship and not having that feeling of loneliness. And that is in itself a secret sauce, because the that's what helps longevity, that helps with getting the motivation to exercise and take care of their bones.
Yeah, no, I love all this that you're saying. So true and so often overlooked. So let's talk about the other area that you're so involved with is food and having a mostly or enough plants in your diet. And you want to share and if really all aspects of health for our bones, for everything. But why don't you share what you have found in terms of I guess you can talk about both mindset and bones in terms of, what you tell people, in terms of food as medicine and why plant-based is so important and, just how you convey that to your patients because you've been very successful with that.
Thank you. And yes, I often ask, what we tend to eat for breakfast, lunch, and dinner snacks and what you drink. And, often it changes. It can change from the environment they're in, who they're with, if they're on vacation. So this always changes what trends are out there. I really emphasize just having as many plants as possible, just having that diversity, not just for our gut, but in our bones and our brain, but it's because we need those key nutrients to build every cell. If it's the mitochondria for ATP, if it's for the antioxidants to take away the stress, or for the calcium. And the calcium, I just want to emphasize that's really the foundation is food, and you can get that in broccoli. And people often forget about that. Broccoli, any greens, collard greens, microgreens, pick your favorite one. And usually people have that their one go-to. And whatever that go-to is, at least have half a cup or 1 cup at 2 meals a day, for lunch and dinner. And that's something that you can just bring as into daily habit, because when I ask for that 24-hour recall, most of the time people are having one plant-based food a day or a week. That's, the average. Um, and you want to add something with things like glutathione-based foods, or even NAC-based foods. And glutathione are the green-based foods. And that's your leafy greens, your green bell peppers, your microgreens, and then the NAC are the red-based foods, just like quercetin. And these are all great for anti-inflammatory foods. And that's going to be your red bell peppers, your red tomatoes. And these are the things that bring not only color, but they all help fight inflammation. They all help contribute to your bones, because most of the time we forget about the impact of bone and inflammation. We forget the impact of how that also gut and bones. And most of the time all these things lack antioxidants in our diet, so we want to bring the most rich antioxidants in our food. And then of course protein is important. Zero point 0.8 kilogram mgs per kilogram, and it goes up with each decade of your life, up to 1 or 1.5 in your activity level. So I think it's important to recognize your activity level, but also know that chickpeas have a lot of protein as well. I love half a cup of tofu for not just protein but calcium, so you're getting the the best of both worlds. And then you can also add this into a smoothie. Some people often think, I have to cook my meals or I have to eat it raw, but do it in a way that's easy. But you can get really creative smoothies. You can have like an avocado with healthy fat, tofu, and some greens, and then put your favorite food in there. And then I love putting things like nut butter, because you always need that for brain health. You need tryptophan and tyrosine based foods, which are the building blocks for norepinephrine, dopamine, and even things like epinephrine and acetylcholine. These help balance your memory and your brain. So everything is multifactorial. So we need healthy fats, we need our omega 3s, we need good healthy plant-based protein, calcium, and antioxidants. There's 5 things that really build a healthy meal. So if it's in the form of on your plate, which I love introducing cooking techniques to my patients, or in the form of smoothies, find something that's simple, easy, and then of course have some fun with it. And that's what I like to do for my patients when they are ready for that step.
Wow, that was great. You wanna just share what a lot of people may not know? They've heard of glutathione and they've heard of NEC, but why would maybe we be lacking that? And can you just go a little more in detail into those 2? 'Cause I know people have heard about them, but I don't know that everybody truly knows how important they are when it comes to so many different areas of our body.
Yeah, glutathione is an important antioxidant. It's one of the powerhouses, and it's the you find it in phase one and phase two detox pathways from your liver, and you pulls out the environmental toxins, even the excess hormones of if it's estrogen or cortisol, and it breaks that down into the liver, and you're able to process this out, pee it out, poop it out. And that's what you want in a healthy detox is you're peeing it sufficiently, pooping sufficiently. Uh, and that glutathione helps really in, you can find it in supplements and IV, but I love it through food, green foods, and it breaks it down so that you can take away all the stressors that came from the environment or from the food or your lifestyle. And now N-acetylcysteine is important because that's a precursor also to glutathione and all goes through the same antioxidant pathways through the detox pathways, but it's also something that helps with anxiety. And that's one of my favorite things to recommend is taking that at night, 600 milligrams, because that's something that has been shown clinically in multiple studies that that reduces anxiety. And it's such a powerful antioxidant and that's easy to take. You take it after dinner and then that calms you down at nighttime. And it's such a powerful supplement that you can use not just for detox, but anxiety. And usually that's found found in women, but also even in menopausal, postmenopausal women to be very helpful.
Oh, thank you. That's great. So let's continue on the food. What have you found by for people introducing also? What are some of the things that you share with your patients that has really seemed to help them when they're trying to do a more bone healthy and overall healthy also, I am right with you in that this stress piece and the mental piece is equally as important and we work hand in hand. But what other foods or what other things do you think are important for people when they're planning their meals, and, what are the other tips that you have found just to be so helpful?
Absolutely. Yeah, it's so important knowing how to just prepare simple meals. And I love recommending just the air fryer, number one. It's just so easy because you can put your air fried tofu or your chickpea, or even if it's you're using salmon, whatever it is, but at least you're not using heavy oils, you're not using heavy salts, and just being able to be able to try new herbs. That's always wonderful if it's paprika, oregano, um, or even looking into other spices like curcumin, or if you're someone who loves curry powders, whatever it is that you want to try it one step at a time, one ingredient at a time, and one device at a time. Some people think they have to get 10 new kitchen tools and get 10 new spices, but really try. I usually say that most people rotate between 10 recipes in like a year, because it's just their go to ones and it's simple. And so pick your favorite 1 to 5 recipes first and just go with it. Small, simple ingredients, 5 ingredients at a time, and then and build upon it. You don't have to memorize a whole cookbook because I know there's so many cookbooks out there, and that in itself is overwhelming. But pick a new recipe, maybe 1 month at a time, and then add to your repertoire. And when it comes to other foods, really, it's important to get lots of pumpkin seeds that has a lot of calcium in it. And I like to recommend at least 2 tablespoons a day. Same thing with sesame seeds are really great, 2 tablespoons a day. Your seeds are very important if you can tolerate it to introduce into your meals. So pumpkin seeds I put into salads, or I put into oatmeal, or I just eat as a snack. It's so easy because there's so many different flavors out there. If it's onion or honey barbecue, and there's very that are very wholesome and with not excessive oil. And I love olive oil based foods and olive oil or flaxseed oil because that has omega-3. Algae oil is really great as well. So you want to make sure you get good calcium sources from seeds. So that's pumpkin seeds, sesame seeds, and as your go-to. And of course, your chia and flax are the basics of
Mhm.
getting healthy omega-3 as well. So if you're getting those seeds on a daily basis, you're really on your way to great total health, but also bone health.
A quick question on that. So for the people though that have issues with oxalates, obviously they would then modify the amounts of the ones that are higher oxalate. Is there anything that you recommend for those people?
Right, absolutely. You can definitely either make sure it's cooked down, soaked well overnight, and you definitely want to look for each seed and each type of because even there's like gold flax seeds and brown flax seeds. They all have different soaking times or cooking times, and you want to make sure that you're not overcooking or undercooking these. Um, and there's sprouted versions and unsprouted versions, and some people, if they have SIBO or dysbiose, they may be sensitive to the sprouted foods. So it's important to know if you can tolerate this first. But really, I always like to say, get to the root. If you have oxalate issues or chronic kidney disease or chronic liver disease, which often impacts bone health because it impacts calcium absorption and alters the parathyroid hormone, you want to make sure you work with a physician or registered dietitian who is very familiar with these diseases, who can customize your nutritional intake because there's always a reason why these are happening. But it doesn't mean eliminate it forever. That's what I like to give patients the hope, but just being able to track and figure out your triggers and of course create a daily journal. And that's the most important thing that you can do without even seeing a provider is have a food journal and have a way of reflecting on your food, not only what you're eating, how much you're eating, but what's happening around that time. What are your symptoms? Even before and after, how you're feeling. And then lastly, you always want to make sure you document your mindset. What are your thoughts? How you're feeling. What's your mood, so that you can see how that's interplaying into your food. I have patients who end up having chronic anxiety because of their health anxiety. We call it health illness anxiety. They're almost to the point where they're fearful with the not just the foods, but just around their health diagnosis. So I completely empathize with you. I totally understand how difficult it is. And I don't want to fear you into any of these big diagnoses, but it's just being able to be self-aware and being kind to yourself during the process, showing yourself grace and love that it takes patience, that takes time and people around you that can support your journey.
It's so interesting because I'm a big person into food journaling, and I know I always have people do like a food mood poop journal that I learned from Andre Nakayama. However, we really don't always. I haven't had people put mindset in, and I think that's such a great idea because, as you've been saying, it's so powerful. I know how powerful it is, but I usually, when they have their journal, don't I have their poop, I have their, you know, I mean, it's food, mood, poop. So I guess their mood is also the mindset too. So I have them put a little bit about the mood in, but I think a really, I think that to really focus on that and see what times of day and how you're eating is just so important. I love that. In terms of tell everyone, because you have something really interesting, how your plant-based mind class, you want to just share? Because I've never heard of anybody, I've heard of all sorts of programs to help with mindset, different things or people who are having issues, but just tell us about that because I think it's a very interesting way to approach certain issues. So, yeah.
Yeah, thank you so much. Yes, this is really 3 years in the making. Just all the recording and the organization and developing it in a way where, first is the total health reset. That's the first part of it. And we all have areas in our life, or we can just modify and reset and get into a place where we can make it aligned. That's the most important thing. Sometimes we're doing this thing there, this one other thing over there, and we kind of pick and choose what we can, what's possible and realistic. But the most important thing is aligning it with a goal, with a North Star, and really finding that North Star is the second piece of it after going through all the lifestyle pillars, nutrition, exercise, sleep. But also the second part of it is going into a place where how can we dive even deeper? What is the purpose of your health? What is the goal of your health? How can we get your motivation back? How can we stay focused? And then looking at all the things that contribute to our mental health, if it's our thoughts, our feelings, our emotions, our previous trauma, our social setting, our environment. How can we look at all these angles and get into a place of healing? So there are times where we have to not only peel the onion, but we have to take up the rock and look at it and appreciate it, and maybe even accept the things that hurt us the most, and maybe go through this cycle of forgiveness, but also to the point where we can actually get the healthy thoughts and the healthy feelings and the healthy foods. That's why the foundation is more plants, so that we can figure out what are the foods, what are the supplements to rewire our brain to because that is the biggest muscle, right? It's the biggest muscle. A muscle has the highest healthy fat content. It has all the hormones there. So we need to go back to what can we do to not only identify the triggers, take away the things that have harmed it over time, but once again rebuild and nourish the brain once again and make it whole again. And that's where we get into the healing, and getting into the power of mindset and plant-based eating.
And so how is the course structured? How long is it? Just give us a few more
Yeah.
details.
So it's 50 videos. It can take, you can do it in a month, or you can take 3 months to do it. You can have 1 year to 2 years to actually get it through and digest, because behavioral change takes up to not only, people think you can have a new habit in 21 days or 52 days, but really it's usually 1 year is really where you see most of the research and studying. It takes 1 year to actually build a new habit and build a new lifestyle. So I always say 1 year, give yourself 1 year to go through the program. And then even the second year is where we do relapse prevention to make sure that you're just able to kind of stay consistent no matter what happens in your life, no matter if you're traveling or if you have new environments or stress, it's okay. You can kind of just go back to the basics and then rebuild again. So it's really a way to get into not only the videos, and then and if needed, of course I offer one-on-one time in my clinic. I've done group classes before, but I really want patients to get the education down, because there's so much out there.
Oh, I love this. So we'll have the link in the show notes. And yeah, what's nice is that everybody can move at their own pace. And so just like you said, so it's not overwhelming and you can just go through it. And you want to also share, because there are some practitioners listening as well. You also did something amazing that, why don't you share about your book?
Yeah, thank you so much. I have it back here. It's kind of fun. I'll just pull it out here. It's called Embody Lifestyle Medicine, and it's how to build a successful direct care practice. And I'm just honored because it just got not only top release in 2 categories, but bestsellers on Amazon. And it's because people need this. People, practitioners are burned out and they're looking for their breakthrough. They're looking for their passion again. They're looking to solve the true questions of medicine. And that's really through lifestyle factors, integrative factors, and get to root causes. So I really just help them gain their confidence and their strategy and build a roadmap to success. That's what it's all about. 300 pages of techniques and tools and even personal stories. And there's lots of freebies in here, as well. I have a lot of handouts and worksheets that you can get as gifts from me. And you can get even some group questions, Q&A. So I do some host some webinars, and then eventually, if you want to see more, I'm always available so that you can get your dream come true. Just like we all have this dream, because every day we have a new beginning, and then that's what I offer. Not only my patients but my providers. We can choose to live the life we want, and this is power.
Oh, I think this is what I really like about this is that I think it's so important, and everything you've talked about today with lifestyle medicine, with the food, with everything, and the mindset is overlooked too often. And more practitioners who can integrate this, I just think they'll be so much more effective. And I really think it's what the world needs now. So thank you so much for writing this. And is it really only for practitioners? I mean, it sounds like there's so many techniques in there that even if someone's not a practitioner, would they benefit from reading it as well?
Yeah, definitely. I have my patients love this book. They bought it and they're like ready. They're like, I just can't wait to learn more from you. Please share all your secret and tools. And so they've been loving it as well. It's helped their own mental health, their own purpose and joy. It's helped them get into the lifestyle pillars even further. So I think it's just exciting because I at my clinic, Dr. Lifestyle, I've seen so much over there. And then in Loma Linda, I've seen people from the rehabs, from the urgent care setting through private practice, the VA. So I have so many tools and stories to share for any type of patient or any type of person who would like to incorporate lifestyle. And it's really been a joy for me to not only make it fun through my cooking channel, by the way, Dr. Melissa's Kitchen, where I have all the recipes, and you can see how visually these foods come to life, and then also you can get a taste and feel by getting into my course or reading this book. And then I'm on social media on Instagram and TikTok and YouTube. So all those things just give an opportunity for you to live your best life and find other tools so you can see it, experience it, and believe that this is something worth your life, and worth your mental health, worth your bones, and you will just feel the difference. And so thank you again for your time, everyone. And Margie, it's just so sweet of you for having me here.
And oh, I love this. Just one very quick question. Do you also work one-on-one with people virtually and in your clinic, or you do both?
I do virtually. So I have different medical state licenses in California, Florida, Pennsylvania, and a couple others. So feel free to reach out. And then I've seen international patients and been an international speaker. So I've definitely been able to see people around the world, and one-on-one virtually, or in Newport. Some people come visit once a year, fly in. So yeah, however is convenient for you.
Oh, great. Well, I'll have all of this information in the show notes, and good luck with your book. That can be really life-changing for so many people and really spreading the importance of everything you've talked about today. So thank you so much. It's been a pleasure, and I'm just really glad I got to learn about you and able to share this important, wonderful, really wonderful information with everybody. So thanks so much.
Thank you so much, Margie. Have a beautiful rest of your day, and I'm sure we'll see each other again.
I hope you enjoyed my interview with Dr. Melissa. And now some new tools you can put into your life. Personally, I'm going to try the rubbing the chest and the stomach before I eat, as well as I love that little massage of the vagus nerve behind the ear. So, the most important part about today's episode, I think, was just to realize how powerful mindset is. And when we look at health, we can't ignore this piece. So, all the links that Dr. Melissa talked about will be in the show notes. And if you enjoyed this episode, I'd really appreciate if you subscribe as well as share it with others, because that's a great way to spread this very important information. So thank you again. I look forward to seeing you on the next episode, and enjoy your day.